Hi, honey. I'm glad you're home. How was work?
Okay, I guess. I've got some bad news.
Well, sit down and tell me about it. What happened?
Remember I told you about Jose and how he's been missing a lot of work lately?
Yes. What's going on with him?
Well, he went to the doctor and it turns out that he's got colorectal cancer.
What? But we just saw him last week. He looked fine.
He had no symptoms, no pain, nothing. He took a test at home that came back positive, so he went to get a colonoscopy, and that's when they found it.
How is that possible? Colorectal cancer? I can't believe it. That poor family. The kids are so young. What's going to happen to them? And Estela, she must be so worried. Ugh, that poor family.
He really does make you think.
When I go to the doctor for my checkup, he always does a pap smear and a mammogram, but he's never mentioned cancer in the colon. And you? You never go to the doctor.
Everyone says that he's really lucky they found it so early. They operated and got it all out. So he didn't have to have radiation or chemotherapy. Thank God, because that stuff is awful. Makes your hair fall out and makes you feel real sick.
Every year in the United States, approximately 142,672 people are diagnosed with colorectal cancer. Approximately 53,219 people die from this disease. Every 2 minutes, someone is diagnosed with colorectal cancer. And every 10 minutes, someone dies from this disease.
Oh, look who's here.
Hi, Mom. Hi, Dad.
Mija, it's so nice to see you.
Hi, honey, how are you?
Here, sweetheart, come sit down.
Thanks, Mom. We just stopped by to say hello.
That's good, Carmen. I'm so glad you guys came by.
What's the matter?
Well, your dad was just telling me about his friend Jose, the one he works with. Turns out he's got colorectal cancer. We just can't believe it.
Oh my God, colorectal cancer? Do you think he'll be okay?
Well, we sure hope so. The truth is, no one knows what's going to happen.
A few years ago, Carlos' aunt died from some type of cancer. I think it was stomach cancer.
Carlos's aunt? Are you sure? I thought only men got this type of cancer.
Well, I don't know. Before this happened to Jose, I never even heard of colorectal cancer.
We should get more information. Jessica, bring me the computer.
Colorectal cancer is a cancer that occurs in the colon or rectum. This area is the last part of the digestive system and is responsible for processing food and eliminating waste from the body. Colorectal cancer is often confused with other types of cancer, like stomach cancer. Colorectal cancer is the second leading cause of cancer death in the United States. It occurs most often in people aged 50 or older, in all ethnic groups, including Hispanics, and affects both men and women. Colorectal cancer usually starts from polyps in the colon or rectum. A polyp is a growth that shouldn't be there and which can, in time, turn into cancer. Screening tests can find polyps, so they can be removed before they turn into cancer. And screening can also identify colorectal cancer early, when the chance of being cured is good.
It says here that people 50 years or older should talk to their doctor about being screened for colorectal cancer. Have you two talked to your doctor about getting screened?
Oh, please, there's nothing to worry about. No one in my family has ever had this type of cancer. Besides, I feel fine.
Dad, on this website, it says that the majority of people who get colorectal cancer have no symptoms and no family history of the disease. It can happen to anyone.
Carmen, you're scaring me. If this can happen to anyone and there's nothing you can do about it, then we should just put ourselves in God's hands.
Oh, Mom, it's not like that. God gave us doctors and medical science so we can take care of ourselves and live long and healthy lives.
Well, that's true. I guess you're right.
Promise me you're going to see the doctor and get screened.
Well, talk to your father, too, because he hasn't been to the doctor in years.
Oh, no, here we go again. Listen, I work. I don't have time to go sit at the doctor's office for hours just to get poked and prodded. A man needs his dignity. I'm not going.
Dad, more than anything, a man needs his health.
Carmen is right. Look, Esteban, it's better to be safe than sorry. I really need you to go with me to see the doctor, and it's really important that both of us make an appointment to get screened. Look, I know you worry about the bills, but we'll figure something out. And if need be, I'm sure Carmen can drive us there.
If you're 50 or older, getting a colorectal cancer screening test could save your life. Because the risk increases with age and both men and women can get colorectal cancer, you should talk to your doctor about getting screened and about what lifestyle choices you can make to reduce your risk of this type of cancer. Lifestyle factors that can increase your risk include diabetes, obesity, smoking, drinking alcohol, and diets high in red and processed meats. Factors that can reduce your risk include changing your diet and exercising. Often there are no warning signs to this deadly disease, so it's important to be tested before symptoms appear. Warning signs include bleeding from the rectum or blood in the stool, diarrhea or constipation for more than a few days, change in bowel habit, a feeling of incomplete emptying, change in the shape of the stool, weight loss, feeling tired all the time, and pain. Pain is a very late sign, so do not wait until then to see a doctor. Through screening and early diagnosis, a person's chance of surviving colorectal cancer improves significantly. When found in late stage, 9 out of 10 people diagnosed with colon cancer will die within 5 years. If found early, however, just 1 in 10 people will die within 5 years of being diagnosed. 3 main tests are recommended beginning at age 50: fecal occult blood test, flexible sigmoidoscopy, and colonoscopy. Talk to your doctor about which is right for you.
Good morning. How are you?
Good morning, doctor.
Good morning, doctor.
Mr. and Mrs. Rodriguez, it's nice to see you again. It's been a long time since you've been in. Tell me, how can I help you today?
Well, a friend of mine at work was just diagnosed with colorectal cancer, and that got us thinking. The more we read about the disease, the more we worry. As you know, neither one of us is that young anymore.
Well, I think we're still young, but as time goes by, there are some things we have to do differently. I'm sorry to hear about what happened to your friend. You've made a good decision to come see me about being screened for colorectal cancer. I'll tell you about a simple test you can take at home. But first, let me show you this model of the complete colon. Here, you can see what is known as the sigmoid colon. Cancer can occur here or in any of these other areas. This pink tissue is the interior of the colon. Here you can see a few small bumps that look like tiny grapes. These are called polyps. Polyps are lesions that can become cancerous. Now, sometimes polyps don't become cancerous, but because they can, it's important to remove them so they can be analyzed. So how do we test for polyps? Polyps sometimes bleed. They can bleed very small amounts from here or here, which is why there's an important test you can do at home that's designed to identify blood in your stool. The naked eye alone can't see these tiny amounts of blood, so when patients tell me, "But doctor, I don't have these symptoms, I don't see any blood in my stool," I tell them that doesn't mean that there's no bleeding, and it's important to determine whether there is bleeding because that can help us detect colorectal cancer early. This test is called a FIT test. It doesn't require any special diet. You can do it at home and send it back in the mail. Then when we get the results, we can tell you whether any further testing is needed. We recommend the FIT test for all patients who are 50 years or older. It's very easy to do. So what do you think?
Well, doctor, I think it's a good idea. How does this test work?
Let me show you the actual kit. I should have one right here that I can show you. It's not as difficult as you might think. For most people, it's no more bothersome than cleaning up after a dog or changing a baby's diaper, even if you haven't done that in a while. The most important thing about the FIT test is that it saves lives. It's easy to do at home, and it could save either one of your lives. So I just open the envelope, and inside is everything needed to do the test. This is the tissue paper that you're going to drape across the toilet bowl. Here you have one of the collection cards and a small applicator stick which you'll use to collect the sample. You begin by placing this tissue paper inside the toilet bowl. After a bowel movement, you'll use the wooden application stick to collect a small sample. Once your sample is on the stick, you'll apply it in a thin layer here inside this window. After that, Close the collection card, and you're done for now. Now, notice that the kit contains 3 collection cards. We need 3 samples because sometimes the polyps bleed and sometimes they don't. They can be dormant and then wake up. So we have a better chance of detecting colorectal cancer if we analyze 3 samples. Once you've collected your 3 samples, take out the mailing envelope and place all 3 cards inside. Peel the tape from the flap and seal firmly. It's very important that you do not place the collected samples in any sort of plastic bag. That will change the test's outcome. You will then mail your FIT test to us. Once we receive it, we'll analyze it and give you your results. If the test comes back positive, then we'll talk with you about the next steps you'd need to take.
In addition to the FIT test, there are 2 other frequently used fecal occult blood tests which are similar, the FOBT and the Guaiac tests. All 3 of these tests can detect blood in the stool and are the first step in early diagnosis of colorectal cancer. If this test comes back normal, you just repeat it again in 1 year. If it is abnormal, which means you have blood in your stool that you can't see, that can be an early sign of cancer, which means you'll need a colonoscopy to verify the diagnosis. A colonoscopy is performed by a specialist who inserts a special tube with a camera inside the colon. During a colonoscopy, a doctor can see if there are any polyps or other growths in the colon. These growths can then be biopsied and checked for cancer, or they can be removed. With a colonoscopy, you will be given a medicine to clear out your colon the day before. And someone will have to drive you to your appointment because you'll be given a tranquilizer that will make you sleepy. Although this test is covered by most insurance, there may be an out-of-pocket cost of $100 or more. We recommend this test be done every 10 years, depending on the patient's profile. The doctor will tell you immediately if he or she sees any growths, and then will let you know the results of the biopsy a few days later. The sigmoidoscopy is similar to the colonoscopy, but can be done by your primary care physician in their office. This tube only goes 1/3 of the way into the colon, and so your doctor cannot see as much as with a colonoscopy, but he can see polyps or other growths, which can then be biopsied to check for cancer or removed. A sigmoidoscopy is less expensive than a colonoscopy and is also covered by insurance, although there may be a small out-of-pocket cost. Sigmoidoscopy is recommended every 5 years. Among cancers that affect both men and women, colorectal cancer is the 2nd leading cancer killer in the U.S. Only half the population is current with screening, and unfortunately, Hispanics are less likely to get screened. If everyone 50 years or older had regular colorectal cancer screenings, about 60% of deaths from this cancer could be avoided. Don't wait. Talk to your doctor about which test or tests are right for you.
Hi, Mija. I'm calling you with some great news. Thanks to you, we went to the doctor and got our colorectal cancer screenings done, and we've just gotten the results back. Yes, and guess what? Everything's fine. The test results were normal. And the best part is we won't have to have another screening until next year.
Have you told your daughter that you run around telling anybody and everybody about this test?
Oh, hush. Your dad. It still embarrasses him when I talk about getting screened, but I don't mind. I'm going to keep talking about how important colorectal cancer screening is because this test saves lives.
The Acción program is committed to helping you take care of your health by providing education, free testing, assistance with insurance, and transportation for colorectal cancer screening. Don't delay. Take Acción today.